Good Monday afternoon, everybody. Thank you for your patience. We apologize for the inconvenience of the technology glitch. We've been doing several of these, and this is the first time we've had a challenge that we couldn't resolve. So I think we have a pretty good track record. So anyway, I'm Dr. Martha Buchanan, the Knox County Health Department Health Officer and Senior Director. Our moment of gratitude today is dedicated to individuals in isolation or quarantine. We know it's difficult and can be a strain on several different aspects of your life, but your selfless decisions to stay home are helping to protect your friends, family, and neighbors. And for that, we are truly grateful. We are continuing to distribute the state-purchased cloth face coverings. For organizations that would like to request a large number of these face coverings to distribute, you may fill out a form on our website. It's under mask order on our main COVID-19 webpage. As a point of clarity, this order is for organizations, not individuals. Individuals can continue to come to KCHD's main location to pick up face masks or face coverings from 8 a.m. to 4:30 p.m. Monday through Friday here at our Dameron Avenue location, 140 Dameron Avenue. We are continuing to do walk-up testing at our main health department location, Monday, Wednesday, and Friday, 9 a.m. to 3 p.m. You do not need an appointment, and so you can just show up at a time that best suits your schedule. We do ask that anyone who is coming to get tested, please wear a cloth face covering to help protect the folks around you who are also coming for testing. Tuesdays and Thursdays continue to be reserved for targeted testing. And on that note, this Thursday, we are offering a walk-up testing opportunity at the Carter Senior Center from 10 a.m. to 2 p.m. You do not need to have an appointment or symptoms to be tested, and testing is at no cost to the individual. We chose this location because it is in an area that doesn't have much access to testing. We are continuing to work on more testing opportunities and are finalizing plans for an additional testing opportunity next week in East Knoxville. Now moving on to our local situation. We have 573 confirmed cases of COVID-19 in Knox County. Additionally, we have 20 probable cases. 470 of our cases have recovered, bringing us to 94 active cases. 56 individuals have been hospitalized at some point during their illness, and currently there are 4 Knox County residents hospitalized for COVID-19. We are once again thankful to be able to report no further deaths from COVID-19 complications in Knox County. As we mentioned last week, the county's Board of Health will meet Wednesday at 5 p.m. to review and consider how Knox County reopens. That meeting can be viewed on community television or streamed at ctvknox.org. Now I'll open it up for questions.
All right, any questions, please go ahead and submit that into the chat feature. And as a reminder, please type in your name and the media outlet in which you're associated with. Thank you. All right, from Vincent with the Sentinel, can you clarify what you are asking the Board of Health to discuss on Wednesday? Is that just the normal mid-phase adjustment discussion, or is it something else?
So the agenda is available publicly, so we sent that out. So on that agenda, you'll see that we're going to talk about, kind of give them some context. We'll also talk about review the existing plans, and they'll make decisions on what happens next, how we move forward in Knox County. So there's a lot for them to talk about. That's why we asked them for a 2-hour meeting. So look forward to their input and the discussion.
Any further questions, please go ahead and submit them into that chat feature now. Paul, it looks like potentially the first part of your question, or maybe the last part of your question, was cut off. So if you could just type that in again, that would be great. Okay, from Paul with WBIR, for each confirmed case, how many people do they potentially infect?
So right now, each confirmed case has 3 to 15 contacts that we're reaching out to. And we are working on tracking how many cases we get from each of those confirmed cases. I don't have that data off the top of my head. Obviously, household contacts are the highest risk because they spend the most time as you've heard from the CDC lately, talking about the amount of time and how close you are to somebody, how much time you spend with them increases your risk. So obviously if you share a home, you're at risk of getting COVID-19 from that person. But we'll look at how we can maybe give you some more information about that in the near future.
From Madison with WATE, it's been understood that Dr. Buchanan is the final word on reopening plans. The change from the county law director said otherwise. Can you talk about your role specifically?
Sure. I've been in this role, not in this role for 16 years, but in the health department for 16 years. And we've really never had to deal with something this larger scale. We do deal with, on a not too infrequent basis, individuals and or entities where we have outbreaks and we have to ask them to change how they operate or even ask them to close for a while until things settle down. We actually work with nursing homes and long-term care facilities when they have cases, and we ask them to close things down as well. But those are individual events, and under my authorities, the health officer, I have the authority to do those things. When we're stepping back, and in the law office's opinion under this emergency order, public health emergency order that the governor put in place, doing something that's community-wide, they really see that as a policy paper. And as they've learned about this response and how we should move forward in it, they've advised me, and we've changed how we do that. So this is something different that we haven't done in the past. Will it change how we operate with the Board of Health going forward? I'm not sure. That's a decision that we'll make together.
From Paul with WBIR, was the Board of Health consulted in previous phases of reopening, and should it have been?
Well, so we consulted with the law office as we moved through. If you recall, there were a couple of orders that were made when we shut things down, and then we moved forward with our planning, and we had not involved the Board of Health, as it had not been the practice to involve the Board of Health. And again, like I said previously, we really have not been a policy-making body. I have not been a policy-making public person since my time here. So this is a shift for making decisions about individual situations and creating policy for the community. So that's kind of the difference. And this is new for us.
From Madison with WATE, the county law director said the Board of Health should have been convened for review of phase 1 and phase 2. What was the reason there was no meeting, and were board members involved? And I believe Dr. Buchanan just spoke to this. If there was anything else you want to add.
I can add. So we operated in a manner in which we had operated in the past, convening a task force of people that we felt like had the expertise to advise us. The Board of Health has since been sent all of those documents. We'll be reviewing those documents this week and this evening, or Wednesday evening, sorry, when we meet.
From Vincent with the Sentinel, what do you anticipate the review and discussion of the phase reopening plan to entail at the board meeting on Wednesday?
It's a great question. We'll have to wait and see.
His follow-up question is, do you anticipate changes to be made to the phase reopening plan?
That's a decision the Board of Health will make together.
Any other questions? Please go ahead and type them into the chat feature. All right, not seeing any more questions coming into the chat feature. So thank you all. And once again, we apologize for the tech issue we had at the beginning. Thanks for bearing with us and for your patience. And we'll work to get that recording online and our Facebook page as well. And we'll talk to you on Wednesday. Have a good one.